first of all, I'm sorry. And it's real. Don't someone's trying to convince you you're too young for it or it's in your head. You know your body, you know what's going on. That's first. Um, it's hard. Your journey is going to be your own. There are things you can do to protect yourself from injury. There are precautions worth taking. Find a good pair of braces you don't mind wearing because braces are uncomfortable. They're not fun to wear all the time, but they could literally save you from the worst years of your life. If you can avoid pain medication, do it. It's better to avoid it. It's definitely harder to regret that and go away from it later. If you can find something else to do with the pain, but ultimately you're going to have to lean on your support network, on the love in your life, and figure out how to just accept the pain. That's sadly where we are until there's a breakthrough that helps fix this issue in our bodies. But yeah, sadly, again, it's just so misunderstood and for whatever reason hard to diagnose. And a lot of people go through trauma just getting a recognition of what their lived experience is, but it doesn't make it any less real.
I can imagine perhaps some people might get misdiagnosed with something like
Mm,
fibromyalgia or
yeah,
polymyalgia when actually they have EDS. I don't know if you've,
or both.
yeah.
Yeah.
Have you come across anything like that?
Like I said, it's so common to have an EDS plus one of these other ones that normally when it's happened with me with thoracic outlet syndrome. Once they saw TOS, they're like, oh, that's it. And then they want EKGs, everything on TOS. And that's fine, right? If there's something there, let's go treat that. But it doesn't take away the other thing. That doesn't explain the hypermobility. So, and look, and if you're double jointed, that does not mean you have hypermobility EDS. And, you can be hypermobility EDS and be double jointed. Like they're not, they can be two separate things. So just because you're flexible does not mean you have this. But if you are in pain, and you notice that your body sublimates or moves out of position easily, you're always trying to stabilize it. Maybe you feel clumsy, you feel dizzy when you're standing up, go talk to a doctor. You might have POTS. Like there are these symptoms to pay attention to and talk to a doctor about. But remember, like your primary care physician is probably not going to diagnose this. You're going to have to talk to a rheumatologist or somebody who understands this. And even then, it can be very, very difficult to get a diagnosis because there's not a genetic marker. They can't do a blood test. All they can do is physically examine you. Yeah, I personally don't think it's a good idea to walk in and say, I have EDS, give me a diagnosis. I think it's better to come in with the symptoms, talk about the risks, talk about the scares you have, talk about the pain, let them come in the diagnosis. Because I do think sometimes people diagnose themselves and they get frustrated that the doctor doesn't validate that diagnosis. I'm not saying that's exactly what's going to happen 100% of the time. I'd be a little careful forcing one on a doctor when you're convinced that's the case.
Is the Baton scale one of the ways in which people are often diagnosed?
Sadly, it's kind of the only way, right, that I know of that is diagnosed because there's not a lot of other ways to accepted ways to index hypermobility. They measure, and from that measurement, they know what's in normal range and what's outside of normal range and by how much. I do, when I went to the conferences, I remember all kinds of talk about new ways they're trying to be able to get a more concrete diagnosis for this. And I do believe something's coming, but that would be a great, like maybe someone from the EDS community, like one of the doctors or something, could come on and talk about that sometimes because there does seem to be always really exciting things coming, but I'm still waiting for the breakthrough. I'd love to know, is it practical in my lifetime or not?
If this sparked something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify or listen on Apple Podcasts. Like, subscribe, and stay connected for more.